There's been a shakeup in the COVID vaccine recommendations for this fall. Who makes the decisions? What does recommendation really mean? And what exactly are the new recommendations? The CDC, through an advisory board, is the group that makes the official statement about what vaccines are recommended and for who. When they say recommend a vaccine for a group of people, insurance companies are generally required to cover the cost. Spoiler alert, although the recommendations have changed this fall, the safety and effectiveness of the vaccines have not. Importantly, the decisions this year were made by an unusual process I describe more in the Substack. These changes may affect whether or not you can get a vaccine if you want one. Let's go through the 5 groups. First is people over 65. The recommendation has not changed. It is still to get vaccinated for COVID if you have not already, and get a booster when your doctor recommends it. This is the group that is at the highest risk for severe disease. The second group is healthy adults ages 18 to 64. The recommendation is that the COVID vaccine or booster is not needed. What does that mean if you still want to get a vaccine? It means it may be harder to find a doctor or pharmacy to give you a vaccine, and insurance may not cover the cost. The cost can be as much as a few $100s. The third group is adults ages 18 to 64 with at least one underlying medical condition. This recommendation has not changed. You should get the vaccine if you haven't already and get a booster to protect you this fall. Interestingly, there is a current extensive list of qualifying medical conditions that you should find on the CDC website. Fourth is healthy children from ages 6 months to 17 years. Before, by the time a child was 6 months old, they should have gotten the vaccine, and older kids should get boosters. Now, if a parent wants to vaccinate a child, they need to consult with the child's pediatric provider in a shared decision-making process. This may make it more difficult to get a vaccine. The 5th group is pregnant people. The new recommendation is that the vaccine is no longer needed during pregnancy. However, pregnancy is a risk factor for more severe COVID disease, and several health societies, including the American College of Obstetrics and Gynecology, disagree with these changes. They continue to strongly recommend a COVID vaccine during any trimester of pregnancy because the evidence for the protective effect has not changed. The good news and the bottom line is that the vaccines for this fall should be protective against the newer variants, and you should get a vaccine if you are eligible.